Welcome back. This segment is sponsored by TLC Eye Care and Laser Centers. It's a way to improve your vision. Dr. Kevin Lavery from TLC Eye Care and Laser Centers is here to talk with us about laser eye surgery. Good morning and welcome. Good to have you here.
Thank you for having me.
Okay, so this laser eye surgery is done for a variety of reasons, right? I mean, improving our vision, yes, obviously, but for restoring lost vision, but also cataract surgeries, right?
So laser is a tool. So we think of laser as one thing, but it's actually, we have dozens of lasers in our practice. Mm-hmm. So there is laser vision correction, which is what you're thinking about for putting eyes back into focus.
Yes, yes.
But we now have a laser that helps us with cataract surgery. So we think of, and a lot of people may have had the misperception that we've had the laser already, but this is just amazing technology where we can use a laser to help us with cataract surgery.
Okay, so does it make your eye look, we're looking, I guess, is that a cataract on the one side of the screen there, that white cloudy?
Sure, that would be an extreme example of a cataract, but absolutely, that'd be the one your friends recognize.
Yeah, no kidding. Oh, you got something bad in your eye, they'd say.
Right.
Okay, so that's serious business. And prior to this, what, you had to use a scalpel or something to cut into that, and now?
Exactly. So cataract surgery would be done by hand. It is painless. But now what we can do is we can use that laser to make the incision. We can use the laser to reshape the eye, so if they have astigmatism. We use that laser incredibly precise. It'll make a perfect circular opening to get to the cataract. It'll soften up the lens for us. We still have to remove it. We still have to put in the new implant, but it's just been a great tool.
That has allowed, as you said, greater precision.
Absolutely.
But I'm guessing it's made it more challenging for you to really adapt to the laser and all the many things that it can do the way that it does.
You know, it actually has been a really easy adaptation because I don't know that it makes the surgery easier, but it does make it safer. But most importantly, the patients get better results.
I was just going to say, does it change outcomes a bit?
It does. So that's what it's all about, right? So it's getting the best outcome possible for our patients. So it takes it up another notch. So yes, I can draw a circle on the paper really well, but I can assure you that a laser with a computer generation can generate
better than you?
Yeah, sorry to say that, but
so
it's
what is the recovery? Is this an in and out kind of a thing nowadays?
It sure is. So the surgery itself normally takes less than 10 minutes. A lot of people do rightly get nervous about it for their first eye.
Sure, of course.
But interesting, their second eye, they're all anxious and excited to get in there and get it done. But the recovery, so the surgery just takes minutes, and most people the next day are back at it full tilt.
Are you serious?
Yeah.
No patching, nothing like that where they have to...
Not normally. There's occasions where you might put a patch on for a few hours, but most of the time there's no stitches, there's no patches. You're still blurry for a few hours. It's not drive-through surgery yet. But the next day, most people can drive and go back to work, and if they want to take the day off, take the day off, but yeah.
Very nice. And so cataracts happen to us how and when in our lives? I think of them as something older people get. Is that the truth?
Yes. The truth is, if we live long enough, we're all going to get cataracts. So
really?
Just as a step backwards, so a cataract is a cloudiness of the natural lens in the eye. So you sort of had a picture, you could see that it was behind the iris. Yeah. So behind that iris, over time, that lens will continue to get cloudier, and it develops differently for all of us. So first of all, if we live long enough, we're all going to get them. And they affect us all differently. But we're seeing lots of 40 and 50-year-olds with cataracts, even now, especially with diabetes, 20 and 30-year-olds. So those Hostess Twinkies,
cut the horde, girls.
Earlier cataracts.
And so people are opting to get it taken care of at a young age, or do you wait till it gets to a certain point where treatment is? What's the smartest way to go about it?
Great question. So I think generationally we're a little different than our parents. I think, our parents, you could take one of their arms off and they'd say it was just a flesh wound. So partly I think we're less tolerant of blurred vision. We're demanding more of our bodies in life. But the technology, the laser and the other modalities have gotten so much safer that we now actually, in some instances, take out the cataract for people that don't even have cataracts. Because when we do the cataract surgery, we can put the eye back into focus. So for most people, we can choose where we want them to be in focus so they don't even need to wear glasses for driving. And so because we're so good on that end, we're doing the surgery at much earlier annoyances. So there isn't the notion anymore that you have to wait for it to ripen, which I've never cared for, because that connotes that if you don't do something now, it's going to go bad. But we are doing them earlier for people.
All right. Well, what a blessing to have access to all this new technology that allows such things. If you'd like more information about TLC Eye Care and Laser Centers, you may find it on our website at WZZM13.com under Take 5 links. Thank you for being here with us. Up next, Chemical Kim shows us the science behind a popular kids' bath product. Stay with us, please.